Hello, everyone. It's Grace Brown. I am the outreach coordinator with Durham's Partnership for Children. I am here to teach you all a little bit more about NCCARE360, which is a referral database. So this is a resource that is available to the families that you serve to connect them with various different resources that they are in need of that you may not be able to provide for them. So I am happy that you all are here and that this video is a part of our Summer Institute. And let's dive in deep more to learn about NCCARE360 and how you all can utilize this resource for your families. So first, an introduction of NCCARE360. It is the first statewide network that unites healthcare and human services organizations with a shared technology that enables a coordinated, community-oriented, person-centered approach for delivering care in North Carolina. So NCCARE360 is an initiative of NCDHHS, which is the Department of Health and Human Services, and the platform is powered by Unite Us and United Way. United Way has one of the programs, which is NC211 is one of the programs of United Way. And NCCARE360 is a branch of that NC211. Agencies included in the NCCARE360 database can electronically connect those with identified needs to community resources through a referral process. NCCARE360 has recently become available in all 100 counties across North Carolina. So we are able to receive referrals for families who may be moving from different counties to Durham, which is very exciting, and vice versa for any families that you all know of who may be moving out of Durham and would need help to get on their feet with different resources. We would also be able to refer families to different counties. The platform of NCCARE360 is completely HIPAA compliant, which is important to note since sensitive information is being shared between organizations. So the services that are included on NCCARE360 are benefits navigation, clothing and household goods, education, employment, food assistance, housing and shelter, income support, individual and family support, legal assistance, mental and behavioral health, money management, payments, physical health, social enrichment, sports and recreation, substance use, utilities, transportation, and wellness. And earlier, as we go into the platform and look at that together, we will take a look at the different categories that fall under each of these services. So the referral process. How are families referred through NCCARE360? So the partnership is one of the agencies included in the NCCARE360 database. So we are able to refer families through the platform. So the ways that families can be referred by the partnership would be families can call or email Grace Brown directly, which is myself, or you all as providers and teachers, you can send a family's contact information in an email or in a phone call to me, Grace Brown. Just if that is what the way that you are going to get families connected, just be sure in that email, I would need a phone number and a brief description of the resources that the family is looking for. So for example, that brief description could be that the family is looking for temporary housing assistance or that they are in need of clothing or diapers, anything of that sort. Families can be referred to Durham's Partnership for Children for both early Head Start and pre-K. And then any health and human service organization that is included in the NCCARE360 platform is able to send referrals to our organization. From there, when our organization receives a referral, we are working with those families to help them apply for either early Head Start or pre-K, or we are getting them connected with a different agency if a family is sent and they're ineligible for either of these programs. So why should families, or you all as providers, why should you choose NCCARE360 to help your families? So the first reason would be that families are connected directly to an organization. So this takes the responsibility off of the family to find that right resource that is provided by the right agency for them. So with this, families who are referred to maybe Durham's Partnership for Children, and their child is ineligible based off of income, or maybe just based off of the county that they live in, if they're referred to us, what I am able to do is send a reason why they're ineligible, and that allows the organization who is sending the referral to see the reason why and try again. So families are really only making one contact with one organization. Their information is being uploaded into the platform, and then all of the human service organizations or healthcare organizations are now working on behalf of the family to get them connected to that right agency. So it really is taking just a lot of the pressure off of families to find the correct resource and get in contact with the right person. Also through NCCARE360, the outcomes for each family and each individual, they are tracked, and most of those outcomes are shared between organizations. So as we stated earlier, the platform is HIPAA compliant, so there are certain outcomes that are not going to be shared between agencies. An example of this would be any families that may be receiving mental health services. If I referred them to a different agency, the agency receiving the referral would then lock that referral so that I am not able to see any of the outcomes that they are tracking in the database. And again, that is just to make sure that we are keeping families' information as private as we possibly can. Another reason why we choose NCCARE360 and why you all should choose NCCARE360 is that client information is stored in the platform so that families can continually receive services. So NCCARE360 is not meant to be a one-time service for families. Once a client's information is uploaded into the platform, it is there forever. So they will always be a client unless they reach out and ask to be taken off of NCCARE360. However, families are only ever contacted by the human service agencies. They would not be receiving any sort of spam or junk mail. So clients' information is stored on that platform forever. And that means that the family is able to just remember, if they can remember who helped them, whether that be the first agency that referred them or an agency that helped them receive a service, they can simply call that agency and ask to be referred for other services. So it's really great and makes it more continuous rather than just a one-time, here is the phone number of an agency that you can call, and then they would have to call again for a different phone number. So I have previously made a video about NCCARE360. So for any of our returning teachers or providers who may already know about the platform, as well as for anyone who's new to it, I wanted to highlight some of the updates that have been made to the platform. Unite Us is constantly working to update the NCCARE360 platform so that it is best serving the residents of North Carolina. So 3 of the updates that have been made is that we can make referrals to NCCARE360 resource navigators. So what these resource navigators are, they are the NC211 operators. So again, if you remember back to the previous slide, United Way is one of the partners, and one of the programs that United Way provides for North Carolina is NC211. And that is still a way that families can receive resources and information about any sort of resource or service that they are in need of. But now me as a referring agency or any other agencies included, if we are unable to find an appropriate agency or an agency that a family that I'm working with would be eligible for, if those are not being found in the NCCARE360 database, I am able to refer them to the resource navigators who would be able to assist the family because they may have more information about the resources and programs that are available to families. We also have what are called out-of-network referrals. So families can still be entered into NCCARE360 and they can be referred to an agency who is not included in the database. Now, this referral may look more like more of the traditional approach in which families are either receiving a phone number or if an agency already has an existing referral process outside of NCCARE360, I'm still able to indicate in this platform that they were referred to that agency. And again, any agency that is not included on the database is known as an out-of-network organization. And these out-of-network organizations, we still have contact information included in the platform that we can give to families. This would just mean that no one from that agency has reached out to be a part of the database, but NCCARE360 has community engagement and community awareness coordinators who are in charge of making sure that every organization that's available in Durham County or anywhere in North Carolina is included on the database, whether they are an out-of-network or an in-network organization. And NCCARE360 can still be used as a tool to track the outcomes for families, even if they are referred to organizations that are not included in the database. So now we're going to transition to looking at the NCCARE360 database together and walk through taking a referral or at least looking through what a client's profile and the referral process looks like. So we will briefly transition over to the platform. And again, I just want to highlight that this part of the platform that we're looking at is what I see as a referring agency. Families are still able to go to NCCARE360.org and see the information about NCCARE360 as well as the agencies included. Their view of the platform would just look different from mine. So first, we're going to take a look at the My Network tab. First, as promised, you can see that here are all of the service types that we previously went over in our slides. And you'll see that under each of those categories, so for this one of education, it is broken down into even more specific categories. So for families who are looking for early childhood education, I'm able to filter out the view of organizations for myself into early childhood education and see those agencies that are close to, right now we are located close to our location. So now we'll take a look at, you can see that the partnership as well as CCSA, both of those are in-network organizations because they don't have any sort of out-of-network organization indicator. But if we kept scrolling, we may run into a few organizations that are not included on the database. So if we go back out and just look at all the organizations that are close to our agency, you'll see that as we scroll down, there are more and more organizations that serve the Durham area that the NCCARE360 community awareness coordinators are aware of, but are not included on the database yet, as well as all of their eligibility information. So this would be an out-of-network organization that I can still refer them to. So next, we'll take a look at a client profile. So we'll go down and look at Grace Smith's client profile and see that at the top, we're always going to see their date of birth, their phone number, and email. in order to easily contact the family whenever it is needed. On this overview tab, I would keep track of all of the conversations that I've had with the family. So I would briefly I can write out that I had a phone interaction, email, or in person, and just keep track of that for my sake. As the referring agency, under the client's profile, we would find their phone number and email address, as well as how they like to be contacted. And all of this information outside of the contact information is not required to be shared. So the personal information other than their name and date of birth, families do not have to indicate their citizenship status, social security, even their race, ethnicity. Again, that just helps us know who the platform is serving and how we can best reach any of those demographics that are not being served. So you'll also see that we can include a household size. Right now, it's just Grace living in the household. But if Grace was a mom and had a child who was in her care, we could add them as a household member underneath here and just indicate how they are related. Again, even for roommates or anyone else who's in the same household, if they would like to be in the same household, they can still indicate that on the database. This is especially helpful when a child is the one who is in need of services, that we are able to indicate that the referral is for the child, but the mother's contact information would be included. We're also able to track any sort of cases that are open right now, any forms that Grace may have, or uploaded documents that we have, and we can track any referrals that have been sent on Grace's behalf. So now we're going to look through what it would look like to send that referral off for Grace. So if Grace was a new client, I would have searched the records to make sure that she didn't already exist in the database. Then I would fill in all of that contact information that we took a look at underneath her profile. And now we are at the step of adding referrals. So I will take a look for the service type of emergency food. And then it will generate a map of all of the agencies that I can refer Grace to. So what I'm going to make sure under each of these agencies, I'm going to look to make sure that I find the correct program that I'm referring the client to. So I'm referring Grace for emergency food. And then I'm going to expand that to make sure that there isn't any eligibility requirements that Grace does not meet. So we see that for the food bank, there are no eligibility requirements. Anyone can be referred, so I will add them. Here is what it would look like for the NCCARE360 resource navigators that we talked about. Again, they're a part of NC211. So this is meant to be the last resort if I am unable to find enough agencies that are providing that resource for families. So as a rule of thumb, we are asked as referring agencies to send the referral to at least 3 organizations if possible. Again, this is just to increase the odds and make sure that a family is truly receiving a service. And in the platform, we're able to automatically recall any of those referrals as soon as the first agency accepts it. So I was going to look under the Durham Center for Senior Life, and I'm going to find the food pantry since we're looking for emergency food, and I'm going to take a look at eligibility requirements. So I see that based off of the age requirements, since Grace is 36, she would not be eligible to be referred to the Durham Center for Senior Life, since the eligibility requirements for age is that they have to be 55 years or older. So with the eligibility requirements, it's really important that we make sure that we look at that so that families can be sent to the correct places and places that are actually able to help them based off of those eligibility requirements. So I'm going to choose a program under the food bank to send Grace to, and then I would write a brief description of what the family is looking for, and then I would send that off in the next step. Now, if I were to create an out-of-network case, now the map that we're looking at will show any of the organizations in the Durham area that are not included that I can still send a referral for. So if you see, they receive off-platform referrals only. So I see, though, that from the work that the community awareness coordinators have looked into, it is open to all. So I might take a look at the website to see if I can get the family over to this organization. And if I did do that, I would just add this. And then once I had that information here, I would write the referral description and then be able to track what is happening with that out-of-network referral. So we're not going to go to the next step together, but if I were, all it would be is to review the referral and then review whether or not the family has provided consent. So I will jump back into this presentation to go over the consent and how families can provide that. So in order for the NCCARE360 database to truly be HIPAA compliant, we have to receive consent from each individual or family in order to send a referral to an agency. So the consent can be collected in one of three main ways. The first would be a signature from the family. That is, if the referral is collected in person, they would be prompted to sign my screen, and then that would be acceptable for consent. Second is we can send a link through text messaging. This takes the family to a web page where they're prompted to sign with their finger and then return it back to our agency electronically. The third is that a link is sent through email to a web page that families would sign using their mouse. And those last two ways of receiving consent are automatically sent through the platform. So as soon as the family clicks approve or send, then it is automatically sent back to me through the platform that their consent has been collected. There are a few other alternative ways to collect consent, but one of these three is definitely the preferred method. However, if a family is unable to receive text messages or they're unable to receive emails, if they're unable to do both of those two, and since our office is still close to the public, so they are not able to come in person to provide consent, there are those other alternatives would help us collect consent that way, in which I can indicate consent on behalf of the family. But again, one of these three ways is the main ways that we like to provide consent, but just wanted to point out that there are ways that families can still be referred even if they are unable to access their text messages or email. After the consent is received from families, all of those referrals that I had created would be sent off. Up until that point, they would be waiting in my database, in which I would be prompted every 2 days to reach out to the family if I'm not receiving consent. After that, all of the referring agencies are given information on if the referrals are collected or not. After a referral is sent, again, it's that 48-hour mark is the standard for NCCARE360. So a family must at least be we must attempt to contact a family 48 hours after receiving a referral. And if we are unable to contact them, then we would need to indicate that and potentially decide to decline the referral, but that is up to the agency who is receiving the referral. So if a family does not hear from the agency that they have been referred to within 48 hours, that is where myself, Grace Brown, would step in as the referring agency and reach out to whatever agency I had sent the family to see if there's any problems or if there's how I can get the family connected with that resource. So families can be assured that we at the partnership are working for them on the behind the scenes level to make sure that their referrals are being accepted and that they are receiving the resources that they need. So again, thank you so much for listening to this information. I hope that you found it informing and that you are excited about NCCARE360 and allowing your families to be connected through NCCARE360. So here is my contact information. Again, please be sure to keep this somewhere in case you do have families that are letting you know that they're in need of certain resources. This is my phone number and email. Either of those ways is fine for you to contact me. I will say that email is definitely preferred, but if you give me a call, I will get back to you as soon as possible. Same with email in order to get connected with that family. You are also more than willing to share this information with your families and let them know that they can reach out to me to be connected through NCCARE360 for any of those resources that you need. I'm looking forward to helping you serve your families and really making sure that we can come alongside you all to assist families with those resources that you may not be able to connect them with or have the capacity to connect them with. That is what NCCARE360 is here for, and that is what I am here for. So again, I hope you enjoyed this presentation, and thank you so much for taking time to learn more about NCCARE360.